Ever wondered why you wake up some mornings under a pitched tent? Or maybe you've noticed it's not happening as often as it used to. We're talking about what's often referred to as morning wood. But what causes it? And does the lack of it signify something more serious, like erectile dysfunction? Morning wood, or to use its scientific term, nocturnal penile tumescence, is a phenomenon that's not fully understood, but there are two main theories. The first is the hormone theory. This revolves around the hormone norepinephrine, which counteracts the hormones that promote erections. During deep sleep, norepinephrine levels drop, causing a spike in these erection-promoting hormones, often resulting in an erection that may still be around when you wake. The second theory is the bladder theory. A full bladder at night can trigger a reflex to prevent urination. The nerves responsible for an erection can be compressed by the enlarged bladder, causing what's known as a reflex erection. This erection can linger into the morning, usually until you empty your bladder. Now, what about the absence of morning wood? Could that be a sign of erectile dysfunction or ED? ED, defined as the inability to achieve or maintain an erection firm enough for sexual activity, could be one reason for the absence of morning wood. ED can be physiological, relating to issues with nerves, hormones, blood vessels and muscles, or psychogenic, related to psychological issues like relationship problems or anxiety. If ED is purely psychogenic, it's still possible to experience nighttime and morning erections. Tests can confirm this. However, before you jump to conclusions, it's important to remember that some healthy people experience morning erections that they aren't even aware of. These erections may begin to subside as you transition from a sleeping to a waking state. So how can you tell if the lack of morning wood is a sign of ED? Well, if you're also having problems with erections during sexual activity, that might be a clue. If you're not sexually active, the absence of morning wood could be the first sign of ED. Certain risk factors could also support your suspicions, including older age, prostate problems, type 2 diabetes, high blood pressure, high cholesterol, use of certain medications, and lifestyle factors like alcohol or drug use and smoking. In conclusion, morning erections are thought to be caused by changes in hormones during sleep or by a full bladder pressing on the nerves that trigger an erection. The lack of morning wood could be a sign of erectile dysfunction, particularly if it's due to physiological issues. If you're concerned, it's advisable to speak with a healthcare provider. They can perform tests to diagnose ED or identify other potential issues. Remember, knowledge is power, and understanding your body's functions can lead to better health and well-being.